And we are live. Welcome everyone. Today on this IOCDF town hall, we're going to be talking about racism and OCD. And before we get started, some housekeeping items to tackle. So this town hall is intended to serve as educational content and is not intended to replace therapy. For treatment-related questions, please be sure to work with your local provider or contact a local clinician. Since the International OCD Foundation is not a crisis hotline, if you're in distress or in crisis or feeling unsafe or suicidal, please go to your local emergency room, call 911 or the Suicide Prevention Hotline at 1-800-273-8255. For viewers and those who leave comments, please remember to be kind and respectful of others. Although this is a public forum and is being recorded for replay online, we still want to create as safe a place as possible. So we are actually waiting for one more member to join us who is having some technical difficulties right now, so we're hoping to get that fixed. In the meantime, let's first introduce Dr. Monnica Williams, who is one of the forefront researchers on this topic. So, Dr. Williams, if you want to let us know a little bit more.
Hi, can you still hear me? I'm just getting a little interference on the line here.
I think a little interference. I do hear you though.
Okay, great. So can you just repeat your question again?
Introducing you, and perhaps you can let everyone know a little bit about yourself and the work that you do.
So I've been really interested in OCD for a long time. I've been a part of the IOCDF for, I don't know, at least 20 years I've been involved. Before it was the International OCD Foundation, back when it was just the OC Foundation. And I've been interested in OCD. I've always found this a really, fascinating and perplexing disorder. And and I just like to see people get better. And so that's why I'm involved. I am the clinical director for the New England OCD Institute in Connecticut. And I'm also on the faculty at the University of Ottawa, where I'm the Canada Research Chair for Mental Health Disparities. And a lot of my work is about race, ethnicity, and culture. And so I'm always excited when I get to combine those interests with OCD and my interest in race, ethnicity, and culture. So yeah, well, so that's what I do.
Thank you so much for being here and educating us about racism and OCD. I think a lot of us rely on a lot of the research that you are doing to give us guidance on how to address some of these issues. I'm Dr. Jenny Yip. I'm the Executive Director of the Renewed Freedom Center in Los Angeles. I'm also a Clinical Assistant Professor of Psychiatry at USC Keck School of Medicine, and I'm the co-chair of the Diversity Advisory Council at International OCD Foundation, which Monnica was our previous co-chair, so I'm filling big shoes right now. So Monnica, while we're waiting for Valerie, perhaps we can just talk about how racism occurs in OCD and how racism can actually make OCD worse.
Yeah, it's a really good question, because I know some people are probably thinking, oh, what do OCD and racism have to do with each other? And unfortunately, there is a connection, not a good connection, because what we find is that racism, if individuals with OCD experience racism, the more racism they experience, the worse their symptoms are. And it's not so hard to think about how that could be the case, because we know that stress will make any any mental condition or physical condition worse. And it's exactly the same with racism. But there are some additional factors which make it even more challenging if you have OCD. For example, if you, oh, hey, look, Valerie,
Oh,
great to
hi.
see you.
Hi. It took a while, huh? Sorry about that.
That's all right. The important thing is you're here.
Yeah. All right. So anyway, I was saying, if someone has experienced racism before in a medical context, which is actually very common, the last thing they're gonna want to do is go to a medical provider and tell them that they have, these runaway thoughts that are really upsetting to them. So if you've experienced racism before, you might be a little reluctant to share this information with a clinician who is probably white, because you're worried about being judged or stereotyped in a way that is not flattering.
Right, absolutely. So, Valerie, thank you so much for joining us. We're just getting started. I'm glad you were able to join us and work out the technical difficulties. I guess before we continue to discuss about racism and OCD, maybe you can introduce yourself and let everyone know a little bit about you and how you came about doing this.
Okay. Well, I always kind of like to start off saying that I'm a Christian because that's important to my personal story and it's very much a part of who I am. But I believe it was in 2009 I went to go see my first therapist, and it would take until 2011 for me to get the diagnosis of OCD. And I struggled with it. I was looking, I was steadily going to therapy. And then in 2007, I came across an article that was talking about the International OCD Foundation's conference. And so I went to the conference in 2007. I was so excited because there was a total, I remember the number, it was 1,721 attendants. And I got very disappointed because when I started to look for people that looked like me, there was only a handful. So I got mad. And I ended up meeting Ethan Smith and Jeff, and they kind of challenged me to step up to the plate. You see, there's a problem with, the numbers and diversity. Well, it was kind of like, what are you willing to do about it? And ever since then, I just got really involved, and it's been great.
And here you are, helping
Yes.
raise a
Who would
little
have
bit
thought?
more awareness
Hmm.
and inform the public and hopefully get some change to occur.
Yeah. I've been
Yeah,
advocating ever since.
yeah. Thank you for sharing that, Valerie. I mean,
Hmm.
of course, this is something that I've noticed and encountered too, having been involved in this organization for so long. I remember when I gave one of my first talks on OCD and cultural differences, and I was so excited, fresh out of grad school, and I went to give my talk, and there was this big room, and there were like 3 people in it.
Yeah.
And I was like, oh no, nobody's here to hear about, what seems to me like a really important topic. But I think we've come a long way since then.
Oh, we definitely have. But I kind of remember too having that same feeling when I went to the conference. And I remember it was on the last night, if I remember right, and it was in the evening, and the only topic on diversity and OCD, uh, the room was a little room with just a few people, in there, and I got the same kind of feeling like, okay, am I welcome here, or not? So I'm very, very pleased and happy to see that the foundation has stepped up and and is giving us this type of opportunity to tell our stories.
Yeah, me too.
And I'm really glad that the Diversity Advisory Council was developed. Probably it's 5 years, been 5 or even 6 years now, right? That's been going on. And, we're trying to do the work and make things happen. So like what I've said at the previous town hall, is that we do need more hands on deck to facilitate this process, since most of us are volunteering our time here. So we can always use more help. So if you also believe that change needs to occur, please contact us, right? So we were just talking about how racism can make OCD worse and how racism can influence the experience of OCD. So I don't know if you wanted to continue, Monica?
Oh yeah. Well, I mean, I could talk about this for a long time, but but we know that there are certain barriers that people of color experience when they're trying to find help for OCD, and we know that it's hard for everyone who wants to get help for OCD. I mean, often people are suffering for years before they even know what they have, and then once they know what they have, sometimes it takes more years for them to like look for help, and then once they look for help, they may not even find it. People often end up in the wrong place. I mean, I talk to so many people in my clinic that have seen, like 5 or 6 therapists before they even got the right diagnosis, and then before even somebody said you need exposure and ritual prevention or some empirically supported treatment. I mean, I've had people who are on the couch with their psychoanalyst for 10 years with OCD. And I'm like, heck, that's malpractice. But anyway, so that's happening. That's happening to everyone across the board. And then when you add onto it that you're a person of color, you're already years behind the process in finding that help. Because if you're looking for someone from your own ethnic group, I mean, forget it, because there's probably only one person in your whole state who is in your ethnic group who knows how to treat OCD, and good luck getting there or getting on the wait list or affording the therapy, because so many of us like don't take insurance. So that's an uphill battle. So if you're looking for someone from your ethnic group to do your treatment, that's a hard thing to find. And so then then that means you may be working with a white therapist. And I've had so many clients of color tell me that they didn't feel like they could open up about their OCD until they felt affirmed in their ethnic identity. And that's something that a lot of therapists don't learn how to do in therapy school. And so you're kind of bucking against these issues as you're trying to get help.
So, again, stats indicate that it takes 14 to 17 years from an average person to be properly diagnosed or actually to receive proper treatment from the time that the symptoms occur, right? And I just want to remind everyone that the proper treatment is exposure and response prevention therapy, which is a type of cognitive behavior therapy, right? Our goal isn't just to talk about your childhood. It might not even involve your childhood at all. It is a very active part of treatment. So we're not just, letting you lie down on the couch and vent about your fears and your anxiety. You're actually going to have to approach and confront whatever it is that you're fearing. So with that already, right? So 14 to 17 years, if you're a person of color and you have all of these different belief system, different cultural stigma that you have on top of the stigma that already exists for OCD, I mean, that can extend the length of suffering much longer than 14 to 17 years. And, hearing from you, Valerie, it sounded like you were able to get a proper diagnosis within, 12 years?
Well, I was fortunate once I did start going to therapy that that therapy led to going to, let me back up. When I went to see my first therapist when I was 54 years old. I'm 64 now. And I believe, looking back on my life, I could see where the OCD was present before then. But, growing up as a baby boomer in the 50s and 60s, I never once thought that I had a mental illness at all. It was the furthest thing from my mind. And I think I got to a point where I was just kind of trying to medicate, not self medicate, uh, you know, self do
Treat
my own
yourself.
thing.
Yeah.
Yeah, treat myself.
Self-soothe.
Yeah, self-soothe. There you go. Thank you. And I was doing that for many years because I thought it was depression or I'm not strong enough. And finally, it got to the point where my husband made me go see a doctor because I had this fear that I was throwing up blood. Um, and I get to the doctor, and it turns out to be nothing but a regular toothache. And when that happened, I just had I think my first panic attack or my first ability to kind of let everything out. And I was fortunate because that doctor asked me if I would like to talk to someone. And that kind of got the ball rolling for me. And so I did in 2009. Like I said, I went to my first therapist. And it wasn't that she wasn't a good therapist, she just wasn't the right therapist for me. And she had all those stereotypes, the white coat. She was younger than I was. She was white. She was cute. All those things. She had the couch, and it was through her going to see her because I was not connecting with with her that she was smart enough to advise me to maybe go see somebody else. And she sent me to a group therapy that was on anxiety. And it was that therapist that realized that I had OCD. And she pulled me aside and she said she thought I had OCD, but she was not a specialist. And she sent me to a specialist who specialized in OCD, who happened to be an African American lady. And that's how it all started for me. So I consider myself to be lucky because once I started trying to find help, it wasn't long before I found it.
Well, that is rare, right? For
Yes.
that to happen because you got a diagnosis of OCD. It sounds like pretty immediately.
Yeah. And that's why I do what I do because I think of all those years that, I wasted. Like I said, I was 54 before I even considered going to go see a therapist and all those wasted years. So that's kind of why I like to advocate, now, especially for women in my generation. There's help out there. You just have to go get it and be open to it.
Yeah, I think a big part of the problem too is that a lot of communities of color, like, we don't want to like air our dirty laundry, and
Hmm.
people say keep it in the community. Don't talk to white people about your problems. How are they going to help you?
Hmm.
How can they understand? How are they going to know? And there's a lot of stigma about having mental health conditions, and even people will say when you're clearly not okay, they'll be like, "Oh, you're fine." And it's like,
Hmm.
no, I'm like really not fine. I'm like been washing my
Hmm.
hands for 6 hours. Like, oh, you're fine, right?
Yeah.
So so there's even like that tension in the culture because there's this idea like, oh, therapy, that's like a white person thing,
Oh,
and
definitely.
you know,
I kind of got the same feedback. I mean, it was like, you can't be a strong Black woman. And, week two, what are you going to a therapist for? That's for a white man, all those kind of stereotypes. And I fed into them in the beginning until I really allowed myself to uh, try to, well, it came to a point where I didn't have a choice but to allow myself to try to get better because nothing was working.
right.
Because we had we bring all of that stuff to the table.
Yeah, exactly. So, I mean, one of the things I'm hoping to help let everybody know is that there are therapists of color out there. There's myself, Dr. Yip, and we're out here doing the work for everyone, and we want people in our communities to know that that it's not just a white person thing.
Hmm.
um, yeah.
And I think for me, once again, I was fortunate with the second therapist that I ended up going to go see for many years. I attribute her to so much of my growth, but she was white. She was blonde. She was my age. She didn't wear the coat. I felt real comfortable with her. But she also had a sense of identity, of a sense of ideal of who I was, and what cultural background I was bringing to the plate. And she was able to kind of address those where that was certainly absent in the original therapist. I think I spent many years just pretending, to be honest. I would go in and we would do work and I would feel like a big fake. I'm faking, trying to get well because we just weren't connecting. So it made such a big difference in finding someone who understood me, like you said, as a Black woman, as a Christian, as a wife, as a mother. All of those things came into play. And like I said, I count myself totally blessed because she was aware of it.
And I think that that's definitely important, because even though if you don't have a person of color in your community who can treat OCD, finding someone who does have the expertise in treating OCD and who can relate to you as an individual is even more important, right? So, I mean, I myself can say that even if I go to an Asian therapist who I might believe could identify with me as an Asian person, I might not connect with that person, right? Or that person may not have the expertise that I need to treat OCD. So I think for therapists out there who may be white, maybe a person of color who is treating someone else of a different ethnic background, I think one of the most important thing is to, recognize the person as an individual and recognize that the person come with their different cultures, belief systems, and to take all of that into consideration as part of treatment. Which I think is very, very lacking in today's environment.
Yeah. I mean, I've trained many therapists over the years, mostly white therapists, graduate students, trainees, postdocs. And, and some of them have had excellent training around cultural issues. Some of them have had none. But I make sure that they all get it because I want every single person they see to feel comfortable, and not just comfortable, but welcome and appreciated and seen for who they are. And so I can say, I know there are lots of great therapists of color. I know there's a lot of good white therapists too. I know there are because I trained some of them. So
good for you.
Yeah.
So just to continue on this conversation, what are some of the effects, the long-term effects of racism? How does that impact a person with OCD, in terms of getting treatment, especially with what's going on in our world today in the last few months?
Yeah. I mean,
let's say that you're Black, and let's say that you have intrusive thoughts of harm. How would that affect you?
Right. I mean, it's devastating because already there's so many negative stereotypes about Black people being violent or criminal or hostile. And then to have to be like, I have to tell somebody, if I'm going to get help, I have to tell somebody that I'm having these violent thoughts. They're going to think I'm a criminal. They're going to lock me up. You have to kind of be able to get past these fears to even get to the point where you're asking for help. And then you have to hope that you find the person that will see past your color and recognize that you have OCD and that you're not a danger. So that's, that's like half the battle right there.
Right. So it's like having that intrusive fear of harm in itself is a huge stigma, and it's a huge deterrent for some sufferers to actually seek treatment. And then if you are a person of color, and if the stigma is, your ethnic background means equal that you are more dangerous, then of course that's going to deter you from seeking treatment even further, or even acknowledging the thoughts, right? I mean, half of the battle in recovering from OCD is to acknowledge, okay, I have these thoughts, yet there is no credence given to these thoughts. However, you can't even acknowledge having the thoughts, then you're just engaging in avoidance behavior. And we know in the OCD world, if you're engaging in avoidance, it only makes OCD louder.
Exactly. So, right. So then you end up suffering for a long time, for maybe the rest of your life, for something that's completely treatable. And on top of that, many people give up and they take their own lives because they don't see a solution, and that's the tragedy too.
Yeah. And I know for me, I didn't realize until till I literally sat down and thought about this topic today, how much racism has played a part in my OCD. And it takes me back to when I was a little girl. Um, it was 1967, 68. Uh, and I was chosen as one of the elite fifth grade students to go to an all white school. And I remember having mixed emotions because I was proud, that I was the elite part of the group, but I didn't realize what it meant. And I think at that point, being maybe 12 years old or so, I wasn't quite aware of racism. It wasn't like in my face, but I tell my story because um, I remember sitting on that bus thinking, okay, I got to be perfect, and I think that was the OCD of me, which I didn't realize. I got to be perfect, got to look perfect, got to act perfect, got to talk perfect, because I'm going to this white school and I'm, this little black Negro girl with all this pressure on her to perform. And my day went great. And or so I thought. And I remember we were lining up to go back to get on the bus when the principal, out of nowhere, pulls me out of the line, literally walks me to the front of the class, and tells me not to come back wearing those window pane stockings that I was wearing. And I remember, even to this day, being 64, I can still feel the disdain and the shame and the fear and all of that I felt in that moment. And I think that was kind of really the first time my OCD told me I wasn't perfect and told me that my skin color was flawed. And so, like, I didn't realize that until many, many years down the road. And for me, it's almost like that blue-eyed, white hair, 60-something principal that told that little 12-year-old girl that she wasn't perfect has played a part in me feeling that way. And I just didn't realize it until therapy. So it can have very long-term effects, I do believe.
Yeah, I mean it's like horrific to hear about that, because when people think about racism, they're like, oh, that was hundreds of years ago.
Yeah.
And no, it wasn't. It was like
right now.
It's happening now, happened to you as a little schoolgirl, carrying that with you, and then the OCD's like, aha, something to grab onto, to make you even more miserable.
And yes, and like I said, growing up in the 60s, we're right in the midst of civil rights. And it was very hard. It's nothing I really talked about until, like I said, recently, because I didn't realize how much of an impact it has had on my life until, I really look at it. If you kind of lay out your life and look at it, I was surprised of all the racism and the effects that it has had on me personally, along with my OCD. And I'm still 64, still struggling with, being told I'm not perfect. But I am comfortable in the skin that I am in. So.
You know what really bothers me is because I work more with the pediatric population and families, it's when I get a kid here, a child who's not white, and they've been suffering from anxiety and OCD, yet they come in with a complete different diagnosis than what they actually have. And lots of times, I think it might be because people see their skin color first, and then attribute a diagnosis based on what they believe this person of this skin color tend to have, rather than looking at the symptom presentation and making a diagnosis based on that.
Yeah, I think that's absolutely true. Unfortunately, I did a research study when I was in Pennsylvania, in Philly, where we brought in Black people with OCD, and one of the things we wanted to know is like, what's been keeping you from getting help for so long? And most of the people, they wanted help, but several of them said, I didn't even know that this was a treatable disorder. And then there were some who were already involved in the mental health care system, and they said, well, the doctors were eager to work on my, alcohol abuse problem or even depression, but with the OCD, they're like, yeah, we'll get to that later, but it never happened.
I never think maybe the alcohol is because of OCD. It's the person's way of dealing with OCD, right? The people don't think that.
Exactly. And I mean, we see so many people with OCD that then causes depression, causes substance use problems, causes anxiety in other areas. And so, I mean, it's always, amazing to treat people for OCD and see so many of those other things just dry up, right?
Yeah, that's true. That's true.
Yeah.
I don't know how you guys, what you guys think of this, but I definitely know that in the Asian community that there is certainly racism against other Asians. So for example, if you're Asian and, one of the stigma is having an emotion, right? I mean, you're allowed to have emotions, just don't share it and display it. So if a person has a mental illness and you express it, then you're actually supposedly bringing shame to yourself, bringing shame to your family, and therefore other people in your, who are Asians will also add that stigma on you. Like, what is wrong with you? Why are you even talking about that? Rather than being able to be a little bit more understanding and compassionate, I would say that it's not even talked about at all. So within Asian community, it's almost like there's racism within our own community, our own culture, to even talk about mental health. So if you have a problem, you're just going to have to suck it up and deal with it rather than try to find help. Because if you try to find help, you're acknowledging something that you shouldn't have, you shouldn't acknowledge, and that is a huge problem, especially for the older generation.
Yeah.
You talking to me?
No,
But go ahead, Monica.
Oh, I was just going to say, in the African American community, like, you're allowed to have feelings, but if you've got a problem, you go talk to the pastor, and or the church. Like, that's where you get your advice and help, and people will pray for you. And then it's like, okay, you like do these prayers, read these scriptures every day. Like, don't ever tell an OCD person that, right? And and then if you have a problem, it's because you don't have enough faith. And that can be like so undermining, and damaging to people.
Yeah, and it goes back to what I was saying when I made the introduction that I'm a Christian. I've been fortunate lately because I have a very supportive team, but it's been my experience that, same as you, Monica, it's nothing we talk about at church. It's like, there's a fear that I want to outsource Jesus and go to the white therapist. And that is so far from the truth. And that's one of the reasons I try to advocate as much as I can, because, I tell people I can love Jesus and go see a therapist, the same. And it has nothing to do with my faith or my belief and all those old stereotypes that we were brought up to believe. You keep it at home. What goes on in this house better stay in this house. All those things. And if you didn't have a resource outside of the church, it's, where do you go? And I thought, for me personally, how far down the line I might have been if someone in all the churches that I have attended in my lifetime would have noticed and said, oh, you know what? Let's go talk to a therapist. That they changed the narrative, that it wasn't such a uh, act of defiance against the church, or your faith, or you betraying your ancestors. I've been told that too. If they can do it, you can do it. All of those things. And I think it's much more prevalent in my age group, the baby boomers, so to speak. I do see a better, or I should say, a greater sense of knowledge within the younger generation.
Yeah. Yeah, I do too. I
They're
do
more
too.
open.
Yeah, I agree. And, and I think, I mean, it's tough because, we haven't necessarily had that culture of, mental health being even part of the conversation. I remember when I told my family I was going to become a psychologist, they were very confused. But you're absolutely right. It's like you can have a therapist and you can have Jesus. You can have both, right?
Yes.
So why not?
Yes.
That being said, I mean, I think more churches are like having like counseling centers and even like licensed therapists in the churches, which I think is fantastic. But as far as I can tell, they don't quite yet have OCD therapists in there. No. Maybe there's one somewhere that does, but
we need to make that happen, Monica.
Good idea. Let's make that our next project. Get some OCD therapists in the church counseling centers.
Good, yeah. And I think with the current state, with the coronavirus and all this going on, the civil disobedience that's going on, I think it's going to really be a great need for the church to step up and address some of those issues in the future.
Absolutely. So, I want to make sure I get to some of these comments and questions that are coming up. So make sure we have time for them. There is a question by Nora Lester Murad. In our experience, the OCD community has not been trauma sensitive enough. Are OCD therapists being trained in trauma? So we are actually going to talk about that in our next town hall. In fact, the next town hall is exactly about that topic. It's about OCD and trauma and racism. Do either of you have anything to add while we're here? So maybe she doesn't have to wait till next week.
Well, I mean, I can say that I train my therapists in OCD and trauma, so I know that they're getting it. And I definitely have seen people who've come in and we thought it was OCD, and then we find out it's trauma. It's the mom who's constantly checking her kids for safety because she had a traumatic experience when she thought one of her kids was going to die. And so we do see that sometimes, and it is important to be able to tell the difference.
Right. And oftentimes trauma can trigger OCD. So at that point, you have to work with both. Yes. Okay, so this one, and stay tuned because that's what next week's town hall will be about. Okay, so there's one from Grace Manier, and I hope I'm pronouncing your name correctly. I'm not really great at pronouncing names. Okay, I'm a cashier at a Whole Foods, and a white customer told me to go back to Wuhan, where I'm from, and that the coronavirus is all because of people like me. First off, I'm not even Chinese. Second, Chinese people did not cause coronavirus. Third, these comments caused my contamination OCD to target myself as a contaminant. So I was constantly disgusted with myself and scrubbing my hands because I felt like I was contaminated, even if I didn't touch anything I had previously deemed contaminated. This racist incident has brought my contamination OCD and OCD in general to a whole different unbearable level. And this came only weeks after getting into a head-on collision car accident that caused me to have scrupulosity OCD and harm OCD thoughts like never before. I guess I've never been at such a low before in regards to dealing with OCD. Well, I mean, I hear so many of those comments, being Asian myself. People are just making these false comments, false accusations against Asian people. And you know, the interesting thing is that contamination OCD occurs pretty highly in the Asian community. We haven't done a research in terms of why that might be, and you know, maybe that's a project in the future for maybe the different subtypes that tend to occur more in different cultural groups. However, you know, I think the thing about OCD is that OCD tends to latch on whatever it is that you care about. So if you care about contamination, that's what OCD will turn the volume up on. If you care about scrupulosity, then that's what, you know, that's what will get louder. And all it requires is one incident to trigger it.
Yeah.
And then as soon as you give that thought, that feeling, that sensation credence, then it will just blow up like wildfire. And I think that's what happened to Grace.
Yeah.
So,
yeah. And I mean, that's I think it's a kind of a perfect example of how racism and OCD can really, you know, basically like light a fire. And I'm so sorry that happened to you, Grace. And I know for African Americans too, I mean, if you just sort of look at racism in general, it's the idea that some other group is like less than, and, you know, that you want to like separate yourself from them. And there's like this whole idea, even if it's not spoken, that they're like somehow going to maybe contaminate you, right? If you think about segregation, the whole idea that like Black people had to use a different drinking fountain than white people, or different swimming facilities. Like my mom say, that used to be like the Black person beach. Like like if you were white, you got your own whole beach, because like one person, like a person of color's foot in the water would contaminate it. And so if you kind of got that also as your, you know, part of your cultural history, you have to think the OCD is gonna be like, oh, there's an opening for me as well. And so we do also know that, yeah, contamination fears are very, very high among African Americans with OCD as well.
right. So, you know, Grace had a question, which is, how do you tackle ERP for OCD when new subtypes of OCD are constantly presenting themselves and appearing for the first time in a while? And, you know, I think the idea is going to be the same, is that as long as you're giving any thought, sensation, feeling, images, credence, then what you're saying is, I believe in you. I believe this thought is true. I believe this thought has value. I believe this image is real. And if you're believing it to be real, then it is real, right? Your mind doesn't know the difference, whether it is a real threat or a false alarm. It simply responds to whatever it is that you're perceiving. So if you're giving it credence, then it will just make it louder. So in any exposure therapy, whether it's to scrupulosity, contamination, racism, you know, the goal is to confront whatever that trigger is to your fear. So rather than avoiding, rather than telling yourself, no, don't think about it, because if you say, no, don't think of chocolate, I'm thinking about chocolate right now. I want some chocolate right now. You know, you want to be able to expose yourself to that trigger while you resist engaging in the safety behavior, which is the compulsion. So that's what exposure and response prevention therapy is. And you would do that for any subtype.
Yeah, and OCD, you know, it comes out in many different ways. And this is why, you know, it's so important we educate people we treat. These are all the different ways OCD can come out. And we're going to address all of them. We are not going to leave any of these here for you, because otherwise it's going to be like whack-a-mole. You know, you're going to beat the OCD in one area, it's going to pop up someplace else. We have to kill it all. Like, you don't leave weeds in your garden. You get them all out, and that's how it is with OCD too. Otherwise, you will exactly see what was described pop up somewhere else.
Yeah,
Exactly. So we have another question from Kyra Citron. How does representations of OCD in media, often inaccurate, and with white actors, affect the stereotypical image of OCD patients and accessing care?
Oh, good question. I mean, if we think about, you know, OCD characters in the media, like what comes to mind, right? Exactly. Often a white person sort of meticulously straightening their tie or a picture or arranging their shoes.
Mm-hmm.
And if this is the image in your mind, when a person of color, comes in the office and says, I'm having these thoughts of hurting children, you're not going to pair that with OCD. And so I think that these depictions are unfortunately sometimes very damaging because they don't show the breadth of the symptoms and of the type of people who are afflicted with OCD.
Mm-hmm.
Yeah.
Exactly. So we have a follow-up question or comment from Nora Lester Murad. When therapists tell OCD sufferers to squash their OCD, it's like telling a person to squash a part of themselves. A trauma-informed approach should help the person accept all of who they are and not have them inflict violence on themselves. Kill it all is a very violent way to state it. No? I'm sorry, Nora. We do exposure therapy, and you know what? To be honest with you, the evidence, one of the evidence-based treatments, or one of the bigger evidence-based treatments for PTSD is prolonged exposure, which is very,
Mm-hmm.
very similar to ERP. And when we tell patients to accept their thoughts, yet not give credence to it, what we're saying is allow the thoughts to come in and not make it any more worthy than what it is. It's just words, right? So a word is a word is a word is a word. The word has
Mm-hmm.
no meaning unless you want to give it meaning. And the way that I like to think about it, it's kind of like if a person says, I'm sorry, right? That phrase, I'm sorry, is supposed to have meaning. However, depending
Mm-hmm.
on how you say it, whom you're saying it to, how often you're saying it, that phrase may lose its meaning. So I'm sorry, I'm sorry, I'm sorry, I'm sorry. You say it 100 times, that phrase starts losing its meaning. And when we do exposure therapy, that's what we're encouraging. We're encouraging sufferers to allow the content in because the content is going to be there whether you like it or not.
Mm-hmm.
And the
Mm-hmm.
question is, are we going to contain it and let it come when we want it to come, or are we going to let it run wild and just like poke you at every which way when you're least expecting it? So when we say doing exposure, we're asking our patients, the sufferer, to be able to allow the content without giving it any more meaning than what it deserves. That's, in
Yeah.
essence, the point of exposure therapy.
Yeah.
And,
And oh, go ahead. Go ahead, Valerie.
I was going to say, I know for me, exposure was the only way that I got better. Um, all the years of being in therapy and going to, CBT and um, talk therapy, all of that was played a part of my healing. But it wasn't until I actively decided, I was tired of living this way, that it wasn't getting any better, that I had to do the EPR, uh, is when my life kind of changed. And it was hard. It's very difficult. I think people who do not suffer from OCD truly cannot understand how difficult it is, especially when you're talking about your mind constantly, telling you something. For me, uh, my anxiety focused around health. Um, but I did 51 days of straight ERP, and it took a little while, maybe around the 26th, 27th day, I was ready to give up. Uh, but I knew that I had to keep going. And sometimes during that treatment, within those 51 days, something clicked and changed over. I can't tell you what day or whatever, but it has made such a big difference in my healing, in my life. What happens instead of going to a 10, I might go to a 3 now. The time in between of having a trigger moment uh, has gone from days to months, and I attribute all of that to doing the work. It's scary, but it is definitely worth it.
Thanks. And I would also add that, sometimes clients, they'll come to my clinic and they'll say, well, I feel like the OCD is helping me some, it's a part of me. And I say, no, the OCD is not your friend. It's not a part of you. It is your enemy, and we will fight it, and we will beat it down. And I'm sorry if that language feels violent, but the OCD is not your friend. The OCD is not helping you. It's not it's not rubbing your feet or bringing you chocolates at night, right? So the way we conceptualize it is that the OCD has you on the defense, right? Every time you give in to the OCD, it's like a bully, and you're giving up ground, and you're avoiding, and you're making your world smaller and smaller. And we take that back. We take it back by going on the offense against the OCD. That means when the OCD says don't, we do. When the OCD says you are, we say so what? And we don't make it our friend. So.
And in fact, a lot of times that involves a lot of the violent language that, Nora is speaking about, right? So if your religiosity, scrupulosity is saying, don't use bad words, guess what we're going to do? We're going to use a lot of those bad words. If it's saying, if your OCD monster is saying, don't have those bad images, guess what? We're going to have a lot of those bad images. So anytime that OCD is telling you not to do something, that is the point of exposures, to be able to confront it and not give it any more value or meaning than what it deserves. The reality is that we all have horrific images. We all have horrific thoughts. However, what differentiates a person with OCD and a person without is that the person with OCD will go, oh my goodness, what in the world just happened? Why did I have that thought? What does that mean? What does that mean about me? How horrible of a person I am. And that is the credence that we are trying to eliminate, because a typical person who has some negative thoughts would go, oh, okay, well, that's silly. Let's just keep it moving, right? Doesn't pay any more attention to it than what it deserves, because the thought is just that. So when Valerie, when you were saying you weren't at a 10 earlier, went to a 3, what I think what Valerie was saying is that we measure everything. We use a scale. It's called the subjective units of discomfort scale. So, we'll always ask our patients, give me a number. And I know you might be tired of hearing us ask for a number. But when we're asking for a number, what we're doing is trying to rate and trying to find a measurable or an observable measurement of where you are in your anxiety from 0 to 10, 10 being the most uncomfortable that anyone can be at, and 0 being absolutely nothing, which no one can ever be at a 0. So, we do this in order to gauge how uncomfortable a person is and whether a person is habituating or getting accustomed to their discomfort. Is their discomfort level decreasing?
And when I started my ERP, I started at a lower level. I didn't go straight at, like I said, my anxiety is centered around the fear of getting sick, the fear of getting cancer. I couldn't even say that word before therapy, because I was afraid I was going to get it just by saying it. But I started off very simple. I started off going and just sitting in the waiting room, for 5 or 10 minutes. And then the next day I would go back and sit in the waiting room, 7 minutes. And I just kept going and going and going and worked my way up the ladder to where I was able to go to a cancer center. But I found out at that time it was too much anxiety. So I went back and didn't attempt to, to do my number 10 highest fear. I kind of went back to a more comfortable level until that I got too comfortable at that level, and I would go up to the next step. And so I took baby steps, and I learned to celebrate every single step I took. Even if I thought, that I was going to go do something today and didn't do it, I celebrated the thought. that,
Yeah.
I thought, and it really kept me going
I think
because,
a lot of my job is to be like a cheerleader.
yeah.
Because when I see you making these steps, I get so excited. I'm like, yes,
Hmm.
yes.
Hmm. Yes. So I don't want people to think, is so fearful or so harmful or so bad that they can't do it. Yes, you can. It's just starting and staying committed. And I know for me, what kept me going was going back to, like I said, having a good therapist. She asked me, where did I want to be in 20 years? And it made me realize, and I remember saying, I just wanted to be alive. But it made me realize I had to look at where I was in my life journey. And if I was going to spend the next 20 years listening to my OCD, or if I was going to spend my next 20 years, like she said, living life.
Right, absolutely. Well, I'm glad
Hmm.
you took the choice to do
Yeah.
the work to get to the relief where that you have right now and the freedom that you
Hmm.
have right now. I do want to get back on the topic of racism and OCD, though. Nora
Okay.
have a follow-up comment. I just want to clarify to make sure that there's no misunderstanding. And then, Nora, I would suggest that you join the town hall next week to really gain a little bit more clarity if we're not being clear enough here. So in her follow-up comment, it's again, no problem with exposure. Exposure therapy saved my daughter, but having experienced trauma, the expectation to self-inflict violence is traumatic itself. Can't tell you
Go.
how strongly I disagree
Go.
with you that using violence is okay. And I just want to clarify that we would never, ever promote harm. That I mean, not harm, like real harm, right? So we would never promote harm to somebody else. We would never promote any behaviors that would be unethical or illegal, right? Though you have to also realize that when a person has fears of harm, whether it's harming yourself, harming other people, or harm befalling a situation, the only way to minimize that fear is to allow ourselves to have the thoughts. Now, when a
Hmm.
situation is illegal, so for example, if I have thoughts of stabbing my dog, I can actually stab my dog. However, I'm not going to actually stab my dog because that's unethical, right? Or to run someone over with a car, I'm not going to actually run someone over with a car. So when we have such fears where it is unethical or illegal, we use imaginal exposures. So we have patients write stories, write narratives about seeing, visualizing their worst consequence occur, recording it on a tape, and then looping it so they're hearing it over and over and over and over again. And the idea
Hmm.
isn't to promote violence. It's not to encourage violence or make violence, make it okay for you to engage in the behavior. The purpose of it is to accept and tolerate the images occurring in your mind, the fears occurring in your mind without the need to react to it. So that's very
Hmm.
different than using violence as a means of purposeful harming, if that makes sense at all.
Yeah, and I will say some of the exposures can look very violent. I've had clients put a knife to their wrist. I've had clients put a
Hmm.
knife to my neck. I've had clients stand on a bridge and read a suicide note. So I've had clients make a noose. So wherever the OCD is going, we're going there
Right,
because
Hmm.
that's how we beat it.
right. But that doesn't mean that we are condoning,
Yeah.
true violence. And a person with harm OCD, and I think this is where it is unclear. Where I know there are some clinicians, some doctors who might put a person on a 5150 hold for dangerous behaviors, but a person with OCD who has harm OCD don't actually want to engage in the harmful behavior,
Hmm.
don't actually want the harm behaviors to occur. You know, because they don't want to, I don't want to think about it, and therefore the thoughts occur even more so. So therefore we have to provide a safe space to allow the thoughts to occur without the compulsive safety behaviors that actually reinforce the whole vicious OCD cycle. So, okay, tell me guys, you know, when it comes to OCD and racism, you know, I think a lot of it leads to this cultural stigma, right? What are some labels that you guys can think of that reinforces, you know, racism?
Mm-hmm. Yeah. Well, I mean, for one, I mean, all the different ways that people have been referring to COVID-19, equating it with Asian things, and hearing that coming from, you know, the president of the United States' mouth, that's gotta be, I don't know. I find it
You called it the
horrific.
China flu or something like that, right?
Right, the China flu or the
Oh,
Wuhan
yeah,
flu
the
or the
China
Kung
flu.
Fu flu or whatever. It's like, really? So I mean, that's one example that comes to mind right away for me.
Right.
Yeah, and I know I think about as a black woman, you know, the label happen to be the strong black woman, or either I'm an angry black woman, or either I'm the video vixen woman. You know, it's never anything positive um, uh, surrounding that when you get all those kind of labels from society. And like I said, for some of us, you know, it's like I've been hearing those things for 50 years. You know,
Oh yeah.
beforehand it was the, you know, the Intimama, or, you know, we were mammies, we were slaves, we were, you know, everything but. And so when all of that stuff gets in your psychic over the years, it can be very devastating. And then, like I said, I didn't realize how uh, emotionally and mentally and spiritually all those labels were affecting me with the OCD, because the
Oh
OCD,
yeah.
like you say, once again, just fed on it and told me I wasn't perfect, you know, told me my skin was too dark, told me that I was too fat, you know, told me all of those things. And society kind of backed my OCD up with it. So it kind of makes you want to lean more toward what the OCD is telling you
Yeah.
prior to getting treatment.
I
You
mean,
know.
yeah, the whole idea, you know, that this whole like strong black woman thing is a
Yeah.
form of racism. And, you know, and I know a lot of black women out there are like, no, I'm strong. I want to be strong. And like, you know what? We want to be strong, right? We do. And in a way that's kind of, you know, that kind of fits with the image we want to have and how we want to think about ourselves. But it's very damaging because the strong black woman, she doesn't take time for herself.
For herself.
She doesn't, yes, so she's bad at self-care. And also, she's not going to go and get mental health care, go to a therapist, because she's just too busy being strong. So, in so much as that strong black woman is keeping us unwell, keeping us overcommitted and exhausted, and having no time for ourselves, it's harmful. It's okay to be strong sometimes, but you can't be strong all the time. No one should have to be strong all the time. It's just like if you turn on a machine and you never turn it off, what's going to happen? It's going to overheat and break. And this is why this is such a problem, because this goes all the way back to slavery, where it's like you had to be strong to go and pick the cotton and put a baby on your hip and go, you know, make the pancakes and then go sleep with your husband, then go sleep with the slave owner, and, you know, and be up at 5 a.m. and do it again, right? So this is not the kind of strong, you know, that I want to have, right? I want to be able to say, you know what, I'm strong now, but you know what? Maybe I'm not strong at 8:30 at night. Maybe that's when, like, I need my husband to bring me dinner. You know, I don't want to be strong all the time.
Yeah.
I feel that right now. With my twins who are driving me and my husband crazy at home 24/7. So I wanted to make sure that, you know, we address, well, where do we go from here? You know, I mean, racism is, you know, is persisting. We're doing what we can to mitigate it, to minimize its effects, to hopefully help the public and therapists understand how it's important to raise their clinical skills in treating people of color. So I just wanted to go over some information of what the IOCDF is doing. So far, I know Jeff Szymanski announced that there are scholarships, right? So there's been 90 scholarships given out thus far in 30 states, 15 African American or Black, 6 Arab or Middle Eastern, 5 Asian or Asian American, 31 Hispanic or Latinx, and 5 who consider themselves multiracial or biracial. It's been done in 12 different languages. Over 50 therapists who accept public insurance, such as Medicare or Medicaid, in a variety of underserved populations in both rural frontier settings. FQHCS or other community-based clinics, school-based health centers, VAs, incarcerated populations, etc. And the IOCDF will actually be creating a specific list of therapists of color who treat OCD. And it will be part of the BIPOC Resource Center that is to be rolling out soon. So, we are doing some things. We've actually been planning this for a long time. So, Monica, you're a pioneer in making sure that this gets addressed. And, this has been kind of an ongoing effort. But again, like I said earlier, there's only so much that each of us can do. And the more people whom we can get involved to help promote change and promote awareness, the more change will actually occur.
Yeah, I'm really excited about these efforts because for so long, a big part of the problem was, there weren't any people of color who were trained to do this work, and now I feel like we're really making a dent in that, and that's exciting. That there are people in every ethnic community. You can go back to their communities and say, hey, if you've got OCD, I can help you. That's like so important, and there's still so much more we need to do, and but it's happening. It's happening.
Yes, thank you.
Yeah, and I think too, it kind of opens the door for people of color that might be suffering from a mental illness. When we have town halls like this, that it is steadily kind of chipping away at the stigma, a narrative that Black people don't get mental illness. So I think there's a great need for more participants outside of therapists, or I should say sufferers, and those with mental illness who are people of color, to bring their stories forward and attend these types of conferences and take advantage of it being like July being Minority Mental Health Month. We have to get used to getting resources and information and knowledge ourselves out there.
So just to piggyback on that, for those clinicians who are interested in becoming more competent in treating people of color with OCD, the virtual conference, the first virtual conference of IOCDF is happening in a week, right? And there's going to be specific panels on diversity issues. So I would highly encourage you to check those out and join us on that. I know we only have a few minutes left, though there are a few more questions that I want to make sure we're able to address as many as possible. So this one is from Mauricio Oliveira. Is there a correlation between racism and sexual obsessions in OCD? Monica, I feel like it's more of a question for you.
Yeah, that's a good question, because actually one of the areas in OCD that I study the most are sexual obsessions. And sadly, we don't have that data actually to say if there's a correlation between racism and sexual obsessions per se. We have data about racism and certain broad categories of problems in OCD, but sexual obsession specifically, we don't know. That being said, there is a lot we do know about sexual obsessions and OCD. And in fact, last year I actually wrote a treatment manual for sexual obsessions and OCD. And if you come to the conference, IOCDF virtual online conference, I'm going to be doing a talk on sexual and violent obsessions in OCD with my co-author, Chad Wetternack. And, and I hope you can make that. But also in my book, we talk a lot about cultural issues too, because that's something that is so important. So, and there are, I think, a lot of important considerations around sexual obsessions, particularly when working with people of color, because of so many negative stereotypes as well. So, yeah.
I'm so glad to hear that you included that cultural component in your book, because there are so many OCD books out there, right? And I don't know of many, if at all, where there is a cultural component. And I know whenever I teach students regarding family systems, it's really the cultural component is pretty much the first thing that I teach, is because if you're treating a family and you have no idea the cultural background that the family is from, how do you even treat the family, right? I mean, the cultural aspect is so important, and you can't judge a family based on your belief system, based on your upbringing, right? So you have to understand and have some awareness of where the family comes from, where the person comes from, based on their cultural background, their upbringing, their traditions, and all of that. So I'm so happy to hear you included that in your book.
Yeah, and actually even better now that I think about it, I just wrote a paper on cultural competencies for therapists when working with OCD. And this was a project I was working on with my grad students, and then I got an invitation from the editor of the Cognitive Behavioral Therapist saying, hey, do you have any papers you might like to submit on behavior therapy and culture and stuff? And I'm like, I can't think of anything I'm doing right now. And then it's like, oh, wait, I have this OCD paper. And he's like, well, that's perfect. So, and he said, there's no page length, which I probably shouldn't have told my students that, because the article is now like almost the size of a book. But all that to say, it's chock full of good stuff. And I'm really excited. And I actually gave the manuscript to IOCDF, and they're gonna take parts of it and use it for the website to provide guidance for clinicians on all sorts of cultural issues, including knowledge and skills and competencies that therapists need to be aware of working across race, ethnicity, and culture. So.
That is so great to hear. Thank you for all of that information.
And you can share it with your students too.
Absolutely. I definitely would like to get a copy of that manuscript. And, if it's close enough to the size of a book, might as well just turn it into another book, right?
Yeah, might as well.
I know more. You just need more work on your plate. Something to think about. Okay, there's a question from PK. How do you differentiate suicidal ideation from intrusive OCD suicidal thoughts? Okay.
Yeah, that's a good question, because I'm sure you've probably had clients too where they've been misdiagnosed as having depression, and maybe they are depressed, but that's not what the suicidal thoughts are about. They're OCD thoughts. So,
right.
So the question I ask is, so does the idea of dying make you feel a little bit at peace, or is it terrifying?
Yeah, that's the biggest question. Right? I think with any of these OCD thoughts, any of the intrusive thought, is that it's not like it fits with your values. It doesn't fit with your belief system or how you feel you want your life to be, right? So if you are, if you feel that the suicidal ideation is authentic, then okay, we do need to, do a suicide assessment on you. However, if that doesn't feel right to you, like you don't really want to end your life, you don't really want to leave this world, you know, the idea of it is actually scary. You don't want to have the thoughts yet because you don't want to have the thoughts. The thoughts keep repeating and coming into your mind. Then that's the big determinator of OCD. You know, it's you don't really want to have the thoughts. You don't. It doesn't make you feel comforted by it. And it actually does the opposite. Um, so, other any final words about racism, OCD? Where do we go from here? What else can we do? What can the public do? What can family do? Patients do?
Come to our conference.
Yes,
Yeah, that's true. Yeah,
definitely.
and you know, I would suggest starting at just gaining more knowledge about mental illness and OCD and specifically. That would be the start, I think. And like I just allowing yourself to know that it's okay not to be okay, that there's help out there, and that it's okay to go seek it, and that you know, it goes back to that hashtag, you know, Black Lives Matter, you know, mental health lives matter. And once we kind of change that narrative and it becomes more comfortable as a topic, you know, with constantly having these sort of conversations, then I think that would be a good starting place for anyone. You know, knowledge is powerful.
I can't agree with you more, Valerie.
Hmm.
And, you
Hmm.
know, again, even though we're doing these town halls during Minority Mental Health Month, the goal is to continue these dialogues,
Yes.
continuing beyond July, because, again, the only
Yeah.
way that we can make change is if we have these uncomfortable conversations. You know,
Yeah.
there's actually a series going on with Emmanuel Ancho, and the title of it is an uncomfortable conversation with a black man. I think that's the title of it. So I would
Oh.
encourage all of you to look it up because you know, I mean, the how he's able to have these uncomfortable conversations and you know, give us different perspective of it is so enlightening. And Matthew
Hmm.
McConaughey was on, I think, the first series, and he had other celebrities on the show. So if you've never seen it,
Hmm.
and you know, it's only like a 10, 15 minute segment. So I would encourage uh, checking it out. And
Yes.
hopefully we can continue to have these dialogues here and continue to have these uncomfortable conversations because
Hmm.
the only way to get past discomfort or and to expand your comfort zone is to expose yourself to the discomfort.
Suppose.
Hmm. Hmm.
Yeah.
So
Then the
this
more
Hmm.
you do it, the easier. The more you do it, the easier it gets.
That is
right,
so
yeah.
true.
So just think of this as a minority exposure. Well, thank you
Yeah.
guys so much for joining us today. Thank you, Monica, Valerie. I'm so
Thank you.
appreciative of you know the topic and what we're doing, and we'll do this again relatively soon, sooner than
Yeah.
later.
Yeah.
Yes.
And
Thank
I
you.
think I thank the board for putting this together. It's so important. Hmm.
And if anyone has any follow-up questions or if you have a question that we didn't get to, please email us and we'll try to get some of your questions answered. Oh, and by the way, I think the deadline to register for the virtual OCD conference is next Wednesday,
Mm,
12
yeah.
Eastern time. So that's 9
Yeah.
a.m. Pacific time. So get to it.
Yeah.
Yeah. And I heard there were some scholarships too. So, yeah.
Yes, yes, all good stuff.
Yeah.
Thank you
Can't wait.
guys.
Thank
Thank
you.
you.
Bye.